So you want to know how to prevent urinary tract infections? Well, this video is all about urinary tract infections and how to prevent them. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. If this is your first time on the channel and you like to get fact-based healthcare information, go ahead and subscribe. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. Read the disclaimer and the links to the article in the description below. So let's get into it. What is a urinary tract infection? A urinary tract infection is an infection of the urinary tract, and this includes the kidneys, ureters, bladder, and urethra. Typically, it's caused by bacteria that come from the skin around the genitalia and anus and enter the bladder through the urethral opening. Commonly, E. coli is the bacteria responsible. Urinary tract infections can be acute, that is with symptoms, or chronic, usually without symptoms. Are there any risk factors associated with urinary tract infections? There are some risk factors associated with urinary tract infections, such as being female, being sexually active and/or using diaphragms. Women that have reached menopause are at risk, as well as those that are diabetic and people using catheters. Let's move on and check the risk factors for men. So these are the risk factors for urinary tract infections in men. Commonly, it's due to an enlarged prostate or BPH. BPH may also predispose to bladder stone formation. Catheters can introduce infections. And if you're uncircumcised or have a metabolic disorder such as diabetes, you may be at risk from having urinary tract infections. Rarely, inflammatory bowel disorders can cause a connection or fistula between the bowel and the bladder and cause urinary tract infections. Sometimes men will say that they pass bubbles of air during urination. Let's check the risk factors for urinary tract infections in children. These include developmental disorders such as reflux, constipation, dysfunctional voiding, and uncircumcised boys under 1 year of age. So what sort of symptoms are associated with urinary tract infections? The symptoms associated with an acute urinary tract infection include burning, frequency and urgency to urinate. Often there's a strong smell with the urine. It can be cloudy, there can be some blood in the urine, and the patient can feel pelvic pressure. Now, if the infection travels to the kidney, there may be associated flank pain, fever, nausea, and chills, and patients should seek medical attention when symptomatic and unwell. So how is a urinary tract infection diagnosed? A urinary tract infection diagnosis is normally straightforward with clinical examination and evaluation of the urine, a urine culture, and leaving imaging studies for patients as needed. Also, if patients have noticed the passage of bubbles in their urine, they should have a cystoscopy to make sure that there's no fistula or connection with the colon to the bladder. So how are urinary tract infections treated? So urinary tract infections are normally treated with medications such as antibiotics or urinary disinfectants. And the antibiotics are usually Bactrim, Amoxil, Keflex, or Cipro, and urinary disinfectants such as nitrofurantoin or Monurol. They all work very well, but all have possible side effects, so do your homework. Medications such as Pyridium or Uracid can ease burning. Increasing fluid intake can help flush out an infection, and some women may get yeast vaginitis after antibiotic treatment. This can be treated with yeast creams or medications, but it's also easily treated by soaking in a tub for 15 to 20 minutes after throwing in a box of baking soda. This makes the water alkaline and kills the yeast pretty quickly. Also be aware that most people with chronic urinary tract infections are without symptoms, and these people usually don't need any antibiotic treatment and can be left alone. Placing people on multiple courses of antibiotics unnecessarily can put people in danger of C. diff colitis. How can urinary tract infections be prevented? So recurrent urinary tract infections are particularly common in sexually active women, and there are steps that can be taken to prevent recurrent UTIs. If these recurrent UTIs are symptomatic, then the patient can be placed on low-dose prophylactic antibiotics such as Bactrim or Trimpex, or a urinary disinfectant such as nitrofurantoin, and taking 1 pill each night. On the other hand, if the patient is asymptomatic, that is without symptoms, they should not be treated. And if you're post-menopausal, vaginal estrogen therapy may be helpful. Also, some women are infrequent voiders, meaning that they hold on to their urine for hours before going to the bathroom. Having large residuals in the bladder may predispose them to infections, and they should learn to pass urine more frequently. Other measures to prevent urinary tract infections include increasing fluid intake, but one should be very wary of the claim to drink 8 glasses of fluid a day, as there is no scientific basis for that claim. Also, there is no evidence that cranberry drinks are any better than water. Urinating after sexual activity may be helpful. Hygiene techniques such as wiping from front to back may limit bacteria going to the urethra, and tampons and sanitary pads should be changed regularly. Breathable clothing may or may not be helpful. On the other hand, sitting around in wet clothing is a myth, and probiotics may or may not be helpful. On the other hand, low-dose prophylaxis is especially useful for reducing your risk for recurrent UTIs and having to visit the doctor. So to recap in this video, how to prevent urinary tract infections, you learned that urinary tract infections were extremely common, particularly in sexually active women, and that they can be easily prevented. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.